Connecting Arizona. Live from the 12 News studios at 200 East Van Buren. This is 12 News Today.
New this morning, from ruling the roads to navigating the aisles of your favorite shoe store, and a worry for a lot of women: chubby ankles, cankles. They can be caused by a lot of things: pregnancy, poor circulation, packing on too many pounds. But one thing is true: cankles can be very hard to get rid of, and they can make women feel very self-conscious.
Small, thick, or thin, the varieties are almost endless. Not the shoes, the feet, and the legs that go into them. And that's spawning a whole new reason for women to worry.
It's kind of an epidemic. No, I've never heard of any treatments.
We're talking cankles.
Cankles are ankles that blend in with the leg and are kind of chubby.
Cankles are not pretty.
One major fitness chain calls it a problem for millions of women, even suggesting by next year, cankles will surpass love handles as the #1 aesthetic affliction in the world.
Women come in looking for help. There's a little bit of self-consciousness, but really they're coming in and saying, I have this issue, please help me.
Heels and neutrals help, but experts say diet and exercise probably won't. Cankles are often genetic.
It didn't happen overnight. It's not going to go away with some miracle treatment.
Or is it? That is the question of the morning. And joining me this morning to talk about it, Valley plastic surgeon Dr. Danielle Shapiro, who is now treating cankles using liposuction. We're going to talk to you in just a moment. And we also want to talk to Shasta Keltz, who underwent the procedure this past summer. We're going to see some of your before and after pictures as well and talk to you. But doctor, let me start with you. Liposuction, obviously nothing new. But liposuction on the ankles is a fairly new treatment. Why is that?
Well, I think that one of the things that we really want to do is have a predictable result. And the ankles, like other parts of the body, are tough when there's no proportion there. When there's excess fat, and a lot of times it's genetic, it is tough because we can't get a lot of skin tightening, and really the skin tightening is what allows that contour that we want to predict a great result. So the ankles, like other areas of the body, we want them to be more streamlined, and we want them to be more in line with the rest of the contours of the body. So this particular kind of liposuction is called VASER, high definition liposuction, is something that was created in Colombia, where I think that there's a high value put on body aesthetics. So a couple of years ago I went down there to Colombia and learned this procedure, and basically what it does is it contours the fat, but also it has a special part of the procedure that will tighten the skin very predictably.
Shasta, we just mentioned you went through the procedure earlier in the summer.
I did.
And we have some before and after pictures to show you here, and also here's some of the pictures of the procedure. How did you feel about the healing process, and also how do you feel about the results? Thank you for wearing a skirt, by the way, so we can get a shot of your legs.
Thank you for having me. I feel like the first week after my procedure was probably the hardest, but it was easier than I thought, so that's a good thing. I kind of prepared myself for anything, for the worst, and then the rest really was just soreness, general soreness, like you'd gone to the gym and worked out really hard, and then every week was better, easier.
And I'm going to ask you real quick if we can get a shot of your legs, since you're, again, kind enough to wear a skirt here, so we can see the real results, the real after shot here. I mean, you look absolutely fantastic. So, doctor, let me turn to you. If I said, you know what, I want legs like Heidi Klum, is that something that you could do?
Well, first, I think I'd have to put you on the rack to make you about 5'10". Okay? And the
I should be so lucky.
Yeah, really. Basically, it really depends upon what you're born with and your bone structure. But the answer is that I can do something to give you a different contour, not just reduce volume, which what regular liposuction does. This procedure can actually help shape in a different fashion to give you something that makes your leg look longer, makes the definition between your ankle and your calf seem more defined, and that's what gives you a longer looking leg.
Well, thank you both for coming in this morning. Certainly an interesting topic. And for more, you can always check out our website, 12news.azcentral.com. We'll be right back.